A joint, also called an articulation or arthrosis, is a point of contact between two bones, between bone and cartilage, or between bone and teeth. It is commonly named according to the bones or portions of bones that join together. Example: the temporal mandibular joint is between the temporal bone and the mandible. Joints are classified structurally based on their anatomical characteristics and functionally based on the type of movement they permit. Here are the two criteria for the structural classifications of joints. First is the presence or absence of a space between the articulating bones, called a synovial cavity. Second, the type of connective tissue that binds the bones together.
Joints are classified structurally as fibrous, cartilaginous, or synovial. Fibrous joints are the articulating surfaces of two bones united by fibrous connective tissue. They have no joint cavity and exhibit little or no movement. Joints in this group are further subdivided on the basis of structures as sutures, syndesmoses, or comphoses. Sutures are fibrous joints between the bones of the skull. Syndesmoses are fibrous joints in which the bones are separated by some distance and held together by ligaments. Comphoses consist of pegs fitted into sockets and held in place by ligaments. Cartilaginous joints are bones held together by cartilage. Only slight movement can occur at these joints, and these are formed when a piece of cartilage joins the bones. Two types of cartilaginous. Synchondrosis, joints containing hyaline cartilage, and symphysis, joints containing fibrocartilage.
Synovial joints. The bones forming the joint have a synovial cavity and are united by the dense, irregular connective tissue of an articular capsule and often by accessory ligaments. These are freely movable joints. Saddle joints consist of two saddle-shaped articulating surfaces oriented at right angles to each other. The joint between the metacarpal bone and the carpal bone of the thumb is a saddle joint. Hinge joints permit movement in one plane only. They consist of a convex cylinder of one bone applied to a corresponding concavity of the other bone. Pivot joints restrict movement to rotation around a single axis. Ball and socket joints consist of a ball at the end of one bone and a socket in an adjacent bone into which a portion of the ball fits. Ellipsoid joints or condyloid joints are elongated ball and socket joints. The shape of the joints limits its range of movement nearly to that of a hinge motion. Gliding joints consist of two opposed flat surfaces that glide over each other.
Skeletal movements involve the movement of body parts relative to. First, we have the coronal or frontal plane. Flexion, a bending movement that decreases the angle of the joint to bring the articulating bones closer together. Extension is a straightening movement that increases the angle of the joint to extend the articulating bones. Hyperextension, usually defined as extension of a joint beyond 180 degrees. Protraction, a movement in which a structure such as the mandible glides anteriorly. Retraction, the structure glides posteriorly. For the sagittal plane, we have abduction, a movement away from the median or mid-sagittal plane. Adduction, a movement toward the median plane. Inversion is turning the foot so that the plantar surface faces medially. Eversion is turning the foot so that the plantar surface faces laterally.
Circular movements. First is the circumduction. Occurs at freely movable joints such as the shoulder. Rotation is the turning of the structure around its long axis. Pronation, rotation of forearm so that the palm faces down. Supination, rotation of the forearm so that the palm faces up.